Kia ora koutou katoa. Welcome to eHealthTALK NZ. I'm Rebecca Macbeth, the media editor at HINS, and today's episode is about reimagining the EMR and is sponsored by Beyond Essential Systems. I'm joined by BES's Head of Engineering, Edwin Monk-Fromont, and Tamanu Product Owner, Megan Lane. So welcome on the show, Megan and Edward. To start off, can you tell us about the origins of Beyond Essential Systems and your electronic medical record system, Tamanu?
Yeah, absolutely. So it's not your normal origin story for a medical record system. BES actually started as a consulting organization, which was built to improve health systems in low and middle income countries. So that started in Pacific Island countries and then spread to other low and middle income countries in other parts of the world. And as we were doing that work, we very quickly realized that there was a need, as part of that health system strengthening, to do a lot of digitization work. And so we looked around for a medical record system that would meet the needs of the sorts of contexts we were working in. And we looked and looked, and we couldn't find one that we thought was adequate. And so we built one, which is very fun for me because I'm a software engineer as my background. And we thought we needed these 5 principles to be covered off. So it needed to be free and open source. The countries that we started off working in places like Samoa, Fiji, Kiribati, we don't expect that they should be locked into an ongoing licensing fee with the vendor. And a lot of the other software that's used in these sorts of settings is open source. And we believe in that as a philosophy, and it works for those sorts of contexts. The next thing was that they need to be desktop and mobile enabled because people will be working in hospitals on a desktop, but also taking it out into the field. And in both situations, it needed to be offline and sync enabled so that the patient record could travel from place to place, but the system could also be used entirely with full functionality when it was offline, because obviously these countries don't have, as New Zealand in some places and at some times, it doesn't always have reliable internet. It needed to be really seamlessly interoperable out of the box so that it could talk to other parts of the health system. And we use HL7.5 for that. And it also needed to have full professional data security. Being a health system, security has to be a top priority. So as I said, we couldn't find an option that met all 5 of those principles, and so we built one, and that became Tamanu. Megan, maybe over to you.
I joined BS at the beginning of 2020 as a Tamanu project manager at that point in time. I think in the initial years we were pretty reactive to our clients and project needs, particularly in the first year. I joined just at the very beginning of COVID-19, and that really drove our product development at that point in time and our roadmap and our planning. But now we're in a position where we're much more proactive and strategic and forward-thinking about Tamanu as a software and engineering team. So it's been a really incredible journey to go on, and it continues.
It's lovely to hear an origin story where you had a problem and you created a solution rather than had a solution when you're going around looking for a problem, which is often the case. So the title of this episode, as I said, is Reimagining the EMR. So you've given us a bit of a taste there of what's different, but can you just talk a little bit more about what differentiates Tamanu from other solutions in the market?
I think the biggest thing is our people-first approach to the design of Tamanu. The biggest question that we always ask ourselves is, how can we make healthcare workers' lives easier and ensure that the focus is placed and remains on patient care rather than documentation and data collection, which so often EMRs can take away from patient care and experience as well. I think we hear a lot of things consistently about EMRs that we do see on the market that are built on much older technology. They're too many clicks, they're clunky, counterintuitive, busy, not easy to pick up. And I think those were really important things, particularly in the settings where we initially implemented Tamanu. We needed to build a product that was easily adopted, sustainable with, low resource settings, low staff numbers, high turnover rates as well, that come in and need to pick up the software quickly. So kind of addressing all of those common issues that we see in EMRs is something that we really take into consideration. And I think thinking about all those qualities make a really robust solution?
And from the engineering side, we've got a great engineering team, and we're based here in Auckland as well as a few in other parts of the world. And for us on the engineering side, it's really about focusing on the fundamentals. We can build new features on top, and there are lots of different features you need in an EMR. What's important though is the fundamentals. So we've got modern tech, we've got a great engineering team, and it's about building something that is new and fresh, but will also last into the future. So we have a product now that is based on that modern tech stack that allows us to add AI, add new integrations, keep up with changing technology over time. So we're really excited about that side of it too.
So, what does it mean in practice to design a software solution with user experience as a priority? And how do you use co-design in your development of new features?
Yeah. So, I mean, very important. Who we're designing and building Tamanu for is always at the forefront of our minds and important for a number of reasons. Patient care remains patient-centered, reducing data entry and the learning burden on users as well, and also improve data integrity, so having single sources of truth for data points, etc. I think as well for us, something that I find really unique to BES is our design process. And within our engineering team, we have a software designer that's embedded throughout the development process of Tamanu. So from the initial requirement being gathered, she's kind of involved in that process right through to the delivery and quality control of the product as well. And I think that's really unique to us and ensures that we're delivering a product that stays really true and faithful to that guiding principle of being a people first and really user focused product as well. On our project management side, we embed our project managers within the organisations that we work with. So whether that be a hospital, a Ministry of Health, an NGO, and that embedding happens pre and post implementation. So generally they might be on the ground working with clinicians to gather requirements and then oversee the implementation, and then will remain on the ground post implementation as well. So our end user engagement is really high. So being able to get that feedback firsthand, gather requirements firsthand is really, really beneficial to our co-design process and ensuring that we're building a high quality and robust software.
And so, can you tell us, where is Tamanu used already? And can you share any customer success stories about its impact there?
Yeah, so at the moment, Tamanu's in 9 countries. And actually, just last week, we signed a new contract to go into a new country, which is really exciting. That list of 9 is growing, which is amazing. I think we have about 2,500 users and over 2 million patients that are tracked using Tamanu across all of our deployments. So in Nauru, a small island nation, every single clinical encounter in the country is tracked using Tamanu. So that's from community level care through to hospital level care. As part of that, we have a school screening program in Nauru, and that covers close to 100% of the children. And every child that's screened as a high risk within this program enters a treatment pathway which can be tracked end to end using Tamanu as well in Kiribati. So recently we did a user survey on Tamanu, overall showing really high scores, 9 out of 10s for do you think the implementation has gone successfully? And would you recommend Tamanu? And that's with some really high numbers of participants within the user survey. And I think what generally we're hearing, and from a range of users as well, so from doctors, nurses, system administrators, all having a really positive experience and validating some of the things we hope bring true to Tamanu. So improved efficiency in their documentation, improved care. Now that all patient history is saved within a single place, the ability to share information across their facilities as well and easily generate reports at a national level. I think the most positive and something we hear consistently across our projects as well is just how easy and accessible the system is for new users to pick up and adopt. That's been, a couple of really positive success stories of Tamanu.
We know BES is now expanding into new territories, as you've just said, but also into New Zealand. So what's unique about your offering to Kiwi healthcare providers?
So we've been through some of them, right? Which is people first design rather than data first, really focusing on the user experience, reducing clicks, making sure that their experience is good and capturing the data in a way that is easy for them. And then we also have modern tech with an engineering team here in Auckland. And, when you look at the pace that we put out features, it feels like a lot of energy is in the software and is in the team. So we went through a state of play for our engineering team. We put out a new release every 2 weeks with significant features in each. which contrasts to some other vendors. We also have that partnership model where we really take a lot of input in from the people we work with. So we treat it as co-design. We know that people will get the best out of the software if it works in the way that fits their context, their workflows, and we take that on board. But the thing that really pricks people's ears up, honestly, when they're making a decision about Tamanu is the price point. So we're very lucky that most of Tamanu's development has been funded by the Australian government. We're privately held, there's no debt to service, there's no equity to service, no venture capital breathing down our necks. And actually, by and large, we run it like a not-for-profit, so we don't take dividends. All of that means that we can deliver Tamanu at about half the price of what we consider to be less great software. There are obviously really high-end softwares, such as Epic. They're unaffordable for a lot of places. But then there are options that are cheaper, but don't really scale that well to the sorts of hospitals that we work in. So we work in very small places, nurse aid posts with just a single nurse working, but we also work in larger hospitals, 50-bed hospitals, 10-bed hospitals. Our largest is a 400-bed private hospital. And so we work at that scale with great software, but at a much better price point than some other options.
I'm sure that is very attractive. As we all know, health is struggling like many areas with keeping the finances in order. So I'm sure that's something that private and public providers are looking closely at. You mentioned, you're working a lot in the Pacific. So how does your experience of delivering to low resource and poor infrastructure settings in that area translate to New Zealand? And what benefits will that bring to the customers here, do you think?
I think on the engineering side, it means that we have had to build really, really robust software because we have to have it be resilient to a whole range of issues. So power outages, network issues, cyber attacks in the sorts of places where the local IT systems might not be as robust internally to that. And so we've put a lot of our engineering effort into making the software deal with all sorts of issues like that. And as a result, it's really best in class in terms of robustness. So our setup there, which you can either do a cloud deployment or an on-site, on-premise deployment, but the most robust, which we use in a lot of these countries, is a hybrid on-site and cloud deployment. And you can have Tamanu running across multiple hospitals or just in a single one, but even in a single one, having a server that's actually physically located at the hospital within the local network and connected to an uninterruptible power supply means that even if the network goes down and the power goes down, people can still access with full functionality their patient administration system and medical records. And that's been really important. And obviously, if you work in the toughest conditions in the world to work in, then your software is just going to be great in situations where things are less tough than that. So it's really battle tested in that way, and it has been since we first started making it about 7 or 8 years ago. The other thing I'd say is that there was a real need from the start to understand the local context because it is very different to other places. And that's meant that organizationally, we've really built that up as a muscle about making sure that we embed with our users. We actually go and work inside the hospital and make sure we understand what's going up, both pre-deployment to understand the requirements, during the development phase, and then post-deployment to make sure that everything's going smoothly and that we provide that support over time as well. And so that model, I think, would translate really well into other markets as well. And people might be surprised about the level of hands-on that we are. As I said, our background is as a consulting company. So we've done a lot of change management. We've done a lot of capacity building, training people. We've done a lot of understanding the requirements, and all of those things translate well to any context.
Just on the change management side, as I would add design principles of Tamanu, it is a very easily adopted and adaptable system, which is beneficial to any healthcare setting and translates well to any healthcare settings. Obviously, getting user and clinician buy-in to a new software and product is so important and can be a really hard transition. And I think Tamanu, just being a really intuitive and easy to learn and clean and modern software, makes that process a lot easier.
Perfect, yeah. Change management is too often low on the list when people are adopting new technologies. So that sounds great. And the other thing that's important is interoperability. especially in New Zealand. So does Tamanu integrate well with other systems? And can you give any examples of where you've done that?
One of our guiding principles and what has been critical to the success of Tamanu is our strength in implementing integrations. And we do support a range of integrations at the moment. So laboratory software. So in a couple of countries, Palau and Nauru, we have a seamless workflow where you order your lab request in Tamanu. That can seamlessly be sent to a laboratory software where results are managed and entered, and those are then returned and observed and notified. Clinicians are notified within Tamanu, so they never need to leave Tamanu to view any laboratory results. Similar for imaging requests as well. Those can be generated within Tamanu. We also have an integration with a software called MSupply, which is a pharmaceutical management software. And soon we'll be able to send medication requests to track dispensing medications as well through that. And additionally, we do have bespoke integrations for financial purposes as well. Maybe, Edwin, you can talk a little bit more to the standards of and the technical
Yeah,
aspects of
yeah,
integrations.
absolutely. So integration and interoperability is all about standards. And so there's lots of standards. People will know of SNOMED, ICD-10, CPT codes. But if there's one standard that people should remember, it's HL7 FHIR. And HL7 FHIR is a really future-focused, forward-thinking standard. So it's the same sort of standard based on REST APIs that every other software that's modern on the internet uses to communicate. It's secure by design, and it'll really set you up for the future of healthcare interoperability. So that's what most of our integrations use is HL7 FHIR. And obviously, as Megan said, we also do bespoke integrations, especially for those sorts of softwares that sit outside of the health space. So with accounting financial software like Xero, they aren't going to implement HL7 FHIR, so we would use a bespoke integration for something like that.
And you're also exploring integration of AI into the EMR. What are your plans in that space?
Yeah, so the first thing with AI in the medical space is to start with a principle of being cautious. We don't want to introduce AI features that will create any sorts of error in the system, especially when we're dealing with health and people's lives. There's places where we could introduce summaries, for example, and we're exploring those, but really being cautious about cognitive biases towards accepting and opt-in versus opt-out. So we're exploring that space, but there's also a lot of energy around AI in places where the quality is already proven and the appetite is already proven as well. So an example there is Heidi. Integrating Heidi is a no-brainer for us. People are already using it, they're loving it. It takes a whole bunch of time out of their note-taking process. And Heidi themselves have done all of that quality assurance and safety exploration. So that's a really great one for us to deliver. The next thing would be our reporting suite. We actually have another software called Tupaya, which is a BI, business intelligence platform, and that's where some of our more complex reports run. Obviously, you can also do reporting within Tamanu. But on Tupaya, we now have an AI-powered visualization builder, which means that you can use natural language and it will go and fetch the right data, which is from Tamanu, but also Tupaya deals with a range of data sources. Fetch all the right data, pull it all together and visualize it either on a map or a chart, give you the option to review it for correctness, make sure that it hasn't made any mistakes, which is the human in the loop principle that we always use as well with AI. And then your work is done. And it's sped up our time to develop visuals from, sometimes it would take a day for a complex visual for our data analysis team to develop. You can do it now in 15 minutes, which is incredible. All of our tech team are using AI in their process. Again, that's human in the loop process, and they are very AI positive, again, with a cautious approach when it comes to the actual features we implement, but with an optimistic approach anytime that we can be more productive with AI. So the team's AI native, and that leads us to, obviously, with that modern tech stack we've got, being able to build AI features on top of that, particularly as it continues to get better and change over time.
And as we know with AI, you've got to have good data and to get good responses out. So data, EMRs is so essential for health systems in order to plan and predict and gain insights into services. So what stories have your customers been able to tell with the help of data from Tamanu?
Yeah, couldn't agree more. The digitization of health systems is really only useful if it leads to improved patient outcomes, both clinical and public health in the settings that we work in. Again, I think we're really fortunate in having our project managers embedded in the projects that we work in, so we can really identify and pull out some of these key success stories around the use of data in our projects. So yeah, a couple of good examples. In Samoa recently, they had a mass drug administration project for lymphatic filariasis and scabies. So individual doses were calculated based on patient weight, and these treatments were recorded within Tamanu, and data was aggregated and visualized in actually another BES product, which is used for data analysis and aggregation to PIA, and that all happened in real time. So after a period of time within this campaign, medications were lower than anticipated, and the public health team could predict that stocks would be depleted before the target population could be treated through this program. So this information helped the team to facilitate and justify an emergency drug order to replenish their stock, so the team could successfully continue the mass drug administration, which then did occur, and achieved really high and successful coverage. We also have a project which is focusing on hepatitis B in Kiribati, and that's a partnership between Kiribati's Ministry of Health and Medical Services. And this digitisation has really helped to improve the longitudinal care of hepatitis B patient and to reduce the number of patients that are lost to follow-up as well. So this has been achieved using a particular feature within Tamanu that we're really proud of. It's our program registry functionality that allows for efficient tracking of patient cohorts and data collection. And yeah, we're really seeing some great success out of that project within Kiribati.
And just finally then, what are your future plans for Tamanu? What can we expect next?
The software is now really battle tested and solid, so we're in a really good place with Tamanu. That provides all of the different functionality you'd expect for both patient administration as well as medical record system. And it's already being used across 10 different time zones with thousands of patient encounters every day. So it's in a really good place. So now we get to do the fun stuff. We get to add extra bits. So as we were talking about earlier, that might be AI features, integrations with new systems, a patient portal, which is our newest feature that we've been releasing. Maybe Megan, I'll hand over to you for that and other things.
Yeah, so we just recently, or in the process of launching our patient portal. I think as everyone knows, just a functionality or feature that's going to empower patients with direct access to health information and enabling communication between healthcare facilities and patients, which is nothing like any of our countries have seen before. So hoping for improved patient experience and really putting the ownership of healthcare data in our patients' hands as well. We're really excited to roll out this new feature, gain feedback, and continue to grow it as a new feature within the software.
So the last thing that we have got planned for the future is we're looking forward to working with other markets, other contexts, and excited to see where that takes Tamanu as well. We've really loved the way that people have had input into Tamanu. And if we partner with hospitals in New Zealand, the private surgical market in particular, we've already had conversations there, and that's where we're seeing some demand for other things that would be really cool to implement as well.
Fabulous. Well, exciting story to follow then. So we are going to have to wrap it up there, though. Thanks so much for joining me today, Megan and Edwin, and for such an interesting discussion. And thanks to Beyond Essential Systems for sponsoring this podcast episode. So be sure to visit their booth at Digital Health Week, which is this November 24th to 27th in Otautahi, Christchurch, and you can learn more. Mā te wā.